Hey there, future diplomats and global citizens. Are you ready for another deep dive?
Absolutely. Always ready to explore the big issues shaping the world.
Awesome. Well, today we're tackling a topic that's generating serious buzz out there, and one that's particularly relevant for you UPSC aspirants.
Ooh, sounds intriguing. What's on the agenda?
We're diving into the U.S. withdrawal from the World Health Organization.
Ah, yes, the WHO. A pretty big development with implications for global health and international relations. Definitely something UPSC could ask about.
Exactly. Understanding this situation inside and out could be key for both those mains and prelims exams. And we've got a fantastic resource to help us unpack it all. An insightful article from The Hindu that really lays out all the angles of this complex situation.
The Hindu, always a great source for in-depth analysis. I'm ready to dive in.
Perfect. Now, what I find fascinating is this isn't the first time the U.S. has considered stepping away from the WHO. Didn't something similar happen just a few years ago?
You're absolutely right. This isn't a brand new development. The Trump administration actually initiated a withdrawal back in 2020.
Well, that's right. I'd almost forgotten about that.
Yeah. He signed an executive order to kick off the process, but then when President Biden took office in 2021, he reversed that decision.
So it was a bit of a political seesaw with the WHO caught in the middle. And now with this new executive order, we're seeing a resurgence of that debate. So round two of the U.S. potentially exiting the WHO.
It seems that way.
For our listeners aiming for those top UPSC scores, this back and forth is crucial to understand. It highlights how global institutions can be swayed by shifting political winds.
Absolutely. It shows how domestic politics can have ripple effects on the international stage.
But what's really driving this latest move? Why is the U.S. considering leaving again?
Well, there are a few key arguments behind the U.S. withdrawal.
Lay them on us.
Okay, so first, there's the criticism over how the WHO handled the COVID-19 pandemic.
Yes, the pandemic. It seems like a lifetime ago now.
I know, right? But it still casts the long shadow. The Trump administration was very vocal about what they saw as a delayed response from the WHO and a lack of accountability from China in those early stages.
Yeah, that blame game was definitely a big part of the narrative back then. So are you saying tensions with China are a factor here?
Absolutely. And that leads into the second argument. The U.S. claims the WHO is overly influenced by China, which they say affects its decision-making. They're accusing the organization of political bias.
So it's not just about the pandemic response then. There's a deeper concern about power dynamics and influence within the WHO.
Exactly. The U.S. feels its interests are being sidelined.
But I'm guessing there's another big piece to this puzzle, something that always seems to crop up in international relations money.
You hit the nail on the head. The financial burden on the U.S. is a major factor. They've historically been the largest contributor to the WHO, footing a significant part of its budget through what are called assessed membership dues and voluntary funding.
Okay, I get the general idea, but for those of us who aren't financial wizards, what do those contributions actually look like in numbers? Could this be a sneaky prelims question waiting to happen?
Haha. It's definitely something to keep in mind for those prelims. The U.S. contributes between $100 to $122 million annually in assessed dues alone. And on top of that, in 2022-2023, they poured in almost $1.3 billion in voluntary funding.
Wow, that's a lot of money.
Yeah, it's a hefty sum. And Trump argued this financial commitment was disproportionate, especially when compared to China's much lower contributions.
All right, that feeds into the unfair burden narrative. This goes beyond just dollars and cents, though, right?
Okay.
I mean, this speaks to those power dynamics within international organizations, a concept that often pops up in mains questions.
Absolutely. It gets to the heart of who holds sway in these global institutions.
So we've got pandemic response, political bias, and that hefty financial burden as the main arguments for withdrawal. But this latest executive order doesn't just talk about leaving. It outlines some concrete actions, right?
You're right. It lays out some immediate consequences.
Like what?
Well, first up is a complete halt to all U.S. funding to the WHO.
Ooh, that's a big one. Cutting off the money supply is sure to have a domino effect. What else is in the order?
It also requires all U.S. government employees working with the WHO to be recalled.
Wow, so pulling back people power as well. A clear sign they're serious about this.
Definitely. And to fill the gap left by the withdrawal, the order directs the administration to find alternative partners, both domestic and international, to take over the functions previously carried out by the WHO.
Whoa. So a major reshuffling of global health efforts is potentially on the horizon.
Yeah, it's a big shakeup.
Makes you wonder about the potential fallout, especially for developing countries that depend on WHO support for essential health programs.
Yeah, it raises a lot of concerns.
What could this mean for them? I'm a bit worried, to be honest.
I understand your concern, and it's a valid one. Let's delve into those potential consequences and explore what this could mean for countries like India.
Okay, let's do it. This is where things get really interesting.
You've hit on a crucial point. The potential consequences are huge, especially for countries that really rely on WHO funding and expertise.
Yeah, I keep thinking about the countries that depend on the WHO for things like disease eradication programs or the efforts to combat HIV and AIDS and malaria, and even for developing vaccines for new diseases that pop up.
Exactly. Those kinds of programs could face major setbacks without that U.S. support.
It's like we're pulling the rug out from under global health efforts.
In a way, yes.
And what about the impact on countries like India? I mean, they have such a massive population and limited resources.
That's a really important consideration. The impact on developing countries could be significant.
How could this withdrawal actually play out in a country like India?
Well, first, we have to consider the financial strain on the WHO itself. The U.S. contributes almost 20% of its total funding.
20%?
Yeah, it's a big chunk. And losing that amount will definitely impact their ability to run all those programs effectively.
Okay, so less funding means less capacity to actually tackle those global health challenges. Makes sense.
Right.
But I'm still trying to picture the on-the-ground impact. For people in developing nations who might be hit hardest by these cuts.
Sure, think about it this way. Things like immunization drives, disease surveillance, maternal and child health initiatives.
Yeah.
The WHO supports those programs in tons of countries, including India.
Right.
And reduced funding could mean fewer resources for those essential services.
So potentially leaving vulnerable populations at risk.
Exactly.
Someone in a rural village in India, this could mean less access to vaccines or fewer healthcare workers to track outbreaks.
That's a possible scenario, unfortunately.
Well, that's a stark picture.
Yeah.
I know our UPSC folks are taking notes on this because it's a perfect example of how international decisions can have real impact on people's lives.
Absolutely.
Yeah.
And it's not just the immediate impact either. We also have to think about the long-term implications for global health security.
Okay, what do you mean?
Well, a weakened WHO could mean a weaker global response to future pandemics. Imagine a world where outbreaks spread faster because countries don't have the resources or coordination to contain them.
That's a scary thought.
Right. It's a scenario we all want to avoid.
This situation really highlights the need for global cooperation, something UPSC examiners often emphasize in their questions, I bet.
For sure, global cooperation is key. And it's not just about altruism either. It's in everyone's best interest to have a healthier world. A healthy world is a more stable and prosperous world for everyone.
Makes sense. Okay, so we've talked about the impact on developing nations. It's a major concern.
Yeah.
But what about the U.S.? What about their own backyard? Surely stepping back from global health has its own set of consequences.
You're right. The U.S. won't be exempt from the potential fallout.
What do you mean?
Well, by withdrawing from the WHO, they risk losing access to all that global health data and expertise.
Ah, I see.
And that could make it harder to track new diseases or respond effectively to outbreaks. And then there's the issue of vaccine development. Exiting the WHO could affect their access to vital resources like influenza strain samples, which are crucial for making effective vaccines.
Oh, wow. So in a way, they're putting their own citizens at risk by limiting their access to all those global resources and information.
It's a complex situation with a lot of trade-offs and unintended consequences.
It's kind of a paradox, isn't it? They're trying to protect their national interests, but potentially jeopardizing their own health security at the same time.
It is. It really highlights the dilemmas that policymakers face in a globalized world. And for our UPSC aspirants, this shows how important critical thinking is and analyzing different perspectives when dealing with international relations issues.
Yeah, there are rarely easy answers in international affairs. So if the U.S. does take a step back, it creates this void in global health leadership. Who steps up to fill that gap?
That's the million-dollar question, and it's where we see some interesting geopolitical shifts happening.
Okay, let's talk about those shifts. I know our listeners are always eager to understand the big picture.
Yeah.
How do we connect the dots between what's happening globally and what it means for different countries?
Right. Well, the U.S. withdrawal opens up space for other major players to get more involved,
Like who?
particularly China and countries within the Global South.
Okay.
China has already made a strategic move by pledging an extra $30 million to the WHO. This is likely to boost their influence within the organization and potentially reshape global health governance overall.
Wow, $30 million. That's a big statement. What about the Global South? Could this be a moment for countries like India to step into a more prominent role in global health leadership?
Absolutely. India has a lot to bring to the table.
Like what?
Well, we're a major player in vaccine production, and we're often seen as a voice for developing nations, advocating for their needs on the global stage. This gives India a unique opportunity to shape a more balanced and equitable approach to global health.
This sounds promising. Could this be India's chance to reshape the landscape of global health? What kind of challenges and opportunities are we looking at? I know our UPSC listeners will be analyzing every angle of this.
It's definitely a moment of great opportunity for India, but it comes with challenges too.
What kind of challenges?
Well, for one, we have to acknowledge that the WHO itself isn't perfect. It's faced criticism for its response times to health crises and internal inefficiencies.
Yeah, I've heard those criticisms.
These issues need to be addressed if the organization wants to regain global trust and maintain its leadership position.
Some might argue that pulling funding is the only way to force the WHO to reform. What are your thoughts?
It's a tough call. While funding cuts might push the WHO to confront its weaknesses, there's a risk that it could backfire. Hinder its ability to function effectively. I think that constructive engagement and collaboration are more likely to drive meaningful change within the organization.
So it's about working with the WHO to make it better, not just abandoning it altogether. But how do we balance pushing for reform while making sure vital global health initiatives don't suffer in the process?
It's a delicate balance for sure. It's about finding that sweet spot between accountability and support. We need to hold the WHO accountable for its shortcomings, but we also need to work constructively to address those issues, explore ways to maintain funding for crucial programs while advocating for greater transparency and efficiency and responsiveness within the organization.
It sounds like we need a multifaceted approach, one that combines pressure with partnership. This is giving me serious model answer vibes for a UPSC mains essay. It's all about recognizing the complexities and different perspectives and proposing solutions that take everyone's needs into account.
Absolutely. And remember, this isn't just an academic exercise. This has real-world consequences. The decisions made today will shape the future of global health. And it's up to informed citizens like our listeners to engage in these debates and advocate for a healthier and more equitable world.
Well said. I am so looking forward to part 3 of our deep dive, where we'll continue to unpack this complex and ever-evolving landscape of global health. But for now, we want to hear from you. What are your thoughts on the U.S. withdrawal from the WHO? What role do you see for India in shaping the future of global health? Share your insights in the comments below. And don't forget to like and subscribe to our channel for more deep dives into the topics that matter.
Welcome back to our deep dive.
Where we're dissecting this whole U.S. withdrawal from the WHO thing.
Exactly. We've covered a lot of ground already. The history, the arguments, and the potential impact on different countries, including, of course, India.
Right. And now we're going to put on our forecasting hats.
Oh, fun.
And explore some future scenarios. This is where you, our future diplomats and policymakers, can really put your analytical skills to the test, just like you'll need to do in those UPSC exams.
It's like a crystal ball exercise for global health.
Exactly. So let's jump into our time machine and see what the future might hold. What's one scenario that could unfold in the coming years?
Well, one possibility is that the U.S. just stays disengaged from the WHO.
Okay.
And that could lead to a more fragmented global health landscape, with countries kind of going their own way, pursuing their own national interests and competing for resources and influence. We might even see a rise in regional health organizations, each with their own priorities, which could make it even harder to address global health challenges.
So less global cooperation and more regional blocks. That sounds like a recipe for trouble.
Yeah.
Especially when it comes to things like pandemics that don't respect borders.
Uh-huh.
It's like we're taking a step backward from the idea of a global community. What's another possible scenario?
Another possibility is that the U.S. withdrawal actually sparks a reform movement within the WHO.
Oh, interesting. Tell me more.
So, faced with losing its biggest financial backer, the organization might be forced to really look in the mirror and address those shortcomings we talked about earlier, streamline its operations, become more responsive to the needs of its members.
Right.
And that could lead to a more efficient and effective WHO, better equipped to handle the health challenges of the 21st century.
So a crisis leading to positive change, the WHO coming out stronger and more adaptable, that's definitely a more optimistic scenario. But we can't forget about the other big players on the global stage. What about China? How could they use this situation to their advantage?
Well, China has already signaled that they plan to increase their involvement with the WHO.
Right, with that $30 million pledge.
Exactly. And they'll likely push for greater influence within the organization. This could present both opportunities and challenges for global health.
I'm curious about their approach. Will China's vision for global health be different from the traditional U.S. role?
China's approach is often characterized by a focus on practical things like infrastructure development, transferring technology, and that South-South cooperation. They've been heavily investing in building hospitals and healthcare facilities in developing countries, promoting traditional Chinese medicine, providing medical training and support.
That sounds like a very hands-on approach, focused on tangible results on the ground. But couldn't you argue that it's also a way for China to boost its own influence, both economically and politically? I mean, it raises questions about soft power and whether there are strings attached to this aid. It's complicated.
You've got it. It's crucial to think about the geopolitical side of China's expanding role in global health, but it's also important to acknowledge that they are making real contributions to improving health in many parts of the world, especially in countries that haven't always gotten the attention they deserve.
It's all about finding that balance, recognizing both the good and the potential downsides. Speaking of key players, we can't leave out India. Where do we fit into this changing landscape?
This is a defining moment for India. We have the expertise, the resources, and the diplomatic clout to really be a leader in global health. We need to grab this opportunity to push for a more just and inclusive system, one that prioritizes the needs of all countries.
I love that vision. But how do we turn that vision into reality? What concrete steps can India take to become a more influential player in global health?
Well, first things first, India should increase its financial contributions to the WHO.
Putting our money where our mouth is.
Exactly. While we've always been a supporter, we need to step up our funding to match our growing economy and global standing.
Makes sense. What else can we do?
We should also be at the forefront of advocating for reforms within the WHO, pushing for greater transparency, accountability, and efficiency, championing efforts to modernize the organization, strengthen its emergency response mechanisms, and ensure it truly reflects the needs of all its member states.
So be a proactive force for positive change. Not just a passive participant. I'm picking up a theme here, taking initiative, shaping the agenda, driving progress. What other avenues can India explore to really cement its position as a global health leader?
India can really use its strengths in vaccine production and pharmaceutical manufacturing to contribute to global health security. We can team up with other countries to develop and distribute affordable vaccines and essential medicines, making sure everyone has access to these life-saving resources, no matter where they live.
It's like we're combining our scientific know-how with our commitment to the greater good. But a strong global presence also means having a strong foundation at home. What can India do to improve the health of its own citizens?
You're absolutely right. Global health starts at home. India needs to keep investing in its own healthcare system, especially in those rural and underserved communities. Focus on things like strengthening primary health care, improving access to quality medical care, and addressing those social factors that contribute to health disparities.
It's about creating a healthier India for everyone, and using that as a launch pad for global leadership. As we wrap up this deep dive, I'm feeling optimistic.
Me too.
The challenges are huge, but we also have incredible potential to make a real difference. Any final words of wisdom for our listeners as they set out to shape a healthier world?
The future of global health depends on all of us working together, taking responsibility, and striving for fairness. We have to move beyond narrow self-interest and embrace a global perspective, one that recognizes how interconnected we truly are. This U.S. withdrawal from the WHO is a wake-up call. It reminds us that global health is precious and something we have to actively work toward and protect.
Beautifully said. And to our amazing UPSC aspirants, remember, this isn't just about acing an exam. It's about understanding how the world works and using your knowledge to create positive change. Stay informed, stay engaged, stay curious. And a big shout out to The Hindu for their incredible reporting, which gave us the foundation for today's deep dive. Be sure to check out their article for a more in-depth look at this whole issue. We hope you found this deep dive insightful and thought-provoking. Don't forget to like, subscribe, and share this episode with all your fellow UPSC enthusiasts. Until next time, keep learning and keep striving for a healthier and more equitable world for everyone.